Hi there, my name is Kristen. I'm going to be performing your comprehensive exam today.
Nice to meet you, Kristen.
Nice to meet you. What's your name?
Eric.
Can you confirm your name and date of birth for me, please?
Eric
You don't have
Cohen.
to, but for purposes of the exam, I would have the patient confirm name and date of birth with 2 identifiers, and I would also perform hand hygiene with the sink and soap and water, but for this case, I'm just going to use the dry alcohol rub right here. So for the purpose of your exam today, I'm going to perform a head-to-toe assessment, starting with your head and ending with your toes through the various systems of the body. And if you have any questions, just let me know. If you're uncomfortable, please let me know, and we'll get started, and I'll let you know what we're doing every step of the way. Okay? All right. So the first part of the exam is going to involve the skin, the hair, and the fingernails. And I would start by just inspecting the skin, starting with the head, moving down to the arms and the legs, and just feeling thickness of the hair for any lumps, any bumps, or lice, or any areas of concern. And hair is well distributed, skin appears to be well moisturized and clean. There are some freckles throughout the arms and the legs as well as the face. And then the next part of the exam, I'm going to just examine the fingernails for capillary refill and for growth or any areas of concern. And capillary refill is brisk in less than 2 seconds. And next part of the exam, I'm going to move into the HEENT system. So I'm going to start with the head as well as the neck. So first, I'm just going to examine the face for overall symmetry and for any abnormalities or any areas of concern. And the face appears to be well, evenly symmetrical and well distributed. And I'm going to palpate the temporal arteries next. Can I have you just remove your glasses just while I palpate your temporal artery? And temporal artery is 2+, no bruits noted, and good pulse, good strength. You can put your glasses back on. And then the next part of the exam, I'm just going to examine the maxillary and facial sinuses for any tension or pain or swelling. It doesn't appear to be any. Next, I'm going to examine the TMJ, the temporomandibular joint. So I'm just going to have you open and close your mouth for me. Very good. Perfect. And next, I'm going to be moving down into the neck and feeling for any palpable lymph nodes along the clavicle as well. There are not any palpable lymph nodes, which is a normal finding. Perfect. And then the next part of the exam, I'm going to move into the eyes. And if you can just take off your glasses for me. So I'm going to first examine the eyes for any areas of abnormality, and eyelashes are well distributed, there's no redness or swelling or discharge coming from the eyes at all. There's no swelling. And have you had any complaints with eyes at all? Any concerns around your eyes at all? And there's no swelling or any palpation. And next, what I'm going to do is test his pupillary reflexes. So if you can just look straight at me. Just going to test your pupillary reflexes. Good. And then the next part of the exam, I'm just going to examine your peripheral vision for me. Okay? So if you can just cover up your right or left eye, you can choose. Okay. And if you can tell me where you see my finger, excuse me.
Yep.
Okay, perfect. And then if you can cover up your left eye for me and just tell me where you see my finger.
Yep.
Perfect. Okay. And then the next part of the exam, I'm just going to do a fundoscopic exam and just examine the retina and the inside of your optic disc, okay? So you can just look straight for me. An optic disc appears to be very clearly defined sharp edges, no hemorrhages or any floaters. And we'll do the same thing on this side. An optic disc is sharp edges, no dullness, reflection is noted, and no floaters or hemorrhages or any areas of concern. Okay. If you need to blink your eyes, that's okay. It's a bright light. Okay. And then the next part of the exam, I'm going to examine the extraocular eye movement. So if you can just follow my finger, just look straight at me, don't move your head, just move your eyes. Just follow my hand, follow my finger. New cardinal movements. Good. Perfect. Perfect. So pupils are equal round, reactive to light, and extraocular movements to all cardinal directions was noted. And then the next part of the exam, I would perform the Snellen eye chart. I do not have a Snellen eye chart that I could perform a vision test on, but I would have the patient stand back about 20 feet, and we would read each line until the patient was not able to read the line, and I would have him cover up one side as we examined left and right vision with the Snellen chart. So that concludes the eye portion of the exam. Next, we're going to move into the ears. So first, I'm going to inspect the external ear, for any abnormalities or any deformities that we see if the patient was wearing hearing aids or anything. Any problems with your ears at all?
No.
Any changes in hearing recently?
No.
Okay. And then the next part, what I would do is examine the tympanic membrane. So tympanic membrane appears to be gray. Reflective light is noted, and it is intact. There is some cerumen noted as we look into the tympanic membrane. And I'm just going to look in on the other side as well, okay? And the tympanic membrane is gray. Reflective light is noted, and it is intact, and there is some cerumen noted as well on this left side. And then the next part of the exam, I'm going to perform the whisper test. So I'm going to whisper a letter, a word, or I'm going to whisper something to you, and you're just going to tell me what you hear, okay?
21.
Very good.
19.
Very good. Okay. So the next part of the exam I'm going to perform, there's two tests. One of them's called the Weber test. The other one's called the Renee test. They're just going to test different changes if there's any hearing loss based on your left side or your right side, or if it's due to sensory or conductive hear loss. Okay? So I'm going to use the tuning fork, and I'm going to place the tuning fork. I'm going to strike the fork. I'm going to place it on the top of your head, and you're going to tell me if you hear equal with both sides, or one side more than the other, one side less than the other. Okay?
Okay.
Any questions?
Nope. No, sounds good. Both sides.
Both sides equal?
Yeah.
Okay. All right. So then the next part of the exam, we're going to test if it's conductive or sensory hearing loss. So I'm going to strike the tuning fork, and I'm going to put it behind your ear, and you're going to tell me when you stop hearing it, and then I'm going to time you. Okay? And we're going to do it on both sides.
Okay.
Perfect. All right. And then just on your left side, okay?
Yep.
Perfect. Okay. And so that concludes the hearing part of the exam. So the next part of the exam, we're going to move into the throat, or actually we're going to move into the nose, excuse me. So for this part of the exam, I'm just going to have you breathe normally. I'm just going to assess the patency of your nares, okay? And just breathe normally for me. Good. And can you sniffle for me? And puff those nostrils for me. Good. Okay, perfect. And now I'm just going to use my otoscope here just to examine the mucosa inside your nares, okay? And mucosa is pink and nice and moist, and there's no lesions or any masses noted. And now the last part of the exam, I'm just going to perform the smell test. So I'm going to put a smell somewhere in your vicinity. I'm going to have you close your eyes, and you're just going to tell me what you smell, okay? So I'll have you close your eyes for me, and you tell me what you smell.
Alcohol white.
Yep, very good. Alrighty. So then the last part of the HEENT system, we're going to move into the throat, okay? So this part of the exam, I'm just going to start by examining your tongue, okay? So if you can stick your tongue out and say ah for me. Perfect. I'm just going to get my pen light, and I'm going to take a peek inside your mucosa. And oral mucosa is pink, and it is intact and moist, and there are no lesions or masses noted on the tongue or on the roof of the mouth. So now I'm just going to move your tongue to the right. Perfect. And now we're going to move your tongue to the right, and then we're going to look underneath, and we're going to look on top. Perfect. Okay. And also what I would do at this point of the exam is perform a gag reflex, but I'm not going to do that. But if I were to perform the gag reflex, I would just very gently stroke the back of the throat or the back of the tongue until we initiated the gag reflex for the patient. So that concludes the HEENT part of the exam. And the next part of the exam, I'm going to move into the cardiac system. So I'm just going to have you lie down for me. Okay. And then to initiate the cardiac exam, I would normally put the bed higher for more ergonomic purposes, but for the purpose of this system, I'm just going to get on my knees and get to the level of the patient. So I would first palpate the point of maximal impulse on the left side of the patient's chest, and I would palpate that. And this exam would normally be done, it would not be done over clothing, but for the purpose of this exam, it will be done over clothing. And then the next part of the exam, I'm going to palpate all the major arteries in the patient's system. So I'm going to start by palpating the carotid artery bilaterally. Very good. Nice, strong carotid pulse, 2+ and regular. And then I'm going to move into the brachial to palpate the brachial artery bilaterally. Very good. And now we're going to palpate the brachial artery on the right side. Okay. And now we're going to palpate the radial artery. And the radial artery on the right side, which is regular, 2+, nice bounding pulse. And then we would palpate the femoral artery as well, okay? And this would also normally be done, would not be done over clothing, but for the purpose of this exam, it will be done over clothing. We measure the femoral pulse bilaterally, which is near the groin. And then we would move into the popliteal pulse, right behind the knee. And we measure that bilaterally. And then we would also move into the iliac. And then we'll move into the dorsalis pedis pulse on the top of the foot, which is regular 2+ bilaterally. Okay, so now that we have measured all of the major pulses, we're going to just do We're going to do the next part of the cardiac exam. We're going to auscultate the mitral, tricuspid, aortic, as well as Erb's point. And we're going to measure this. We're going to listen to this with the diaphragm of the stethoscope, as well as the bell of the stethoscope to examine the S1 and S2 sounds of the heart, as well as to listen for any murmurs or any other added sounds such as S3 and S4. Just going to switch over to the bell of the stethoscope now. Okay, very good. So now the next part of the exam, I'm just going to listen to all of the arteries that I previously palpated. I'm now going to listen to those major arteries for any bruits or any abnormal sounds that could occur. So I'm going to start with the carotid, and then I'm going to move into the aorta, the iliac, the femoral, and the renal arteries. Okay, good. All right, so you can sit up, okay? So that concludes the cardiac portion of the exam. And the next part of the exam is going to be with the respiratory system. So for this part of the exam, because I have to listen to the posterior side, I'm going to have you sit in the chair for me, okay? And then I'm going to start by examining for any fremitus and assess for tympany as well as symmetry on the posterior. So I'm going to have you say 99 for me as I place my hands on the posterior side of the back, looking at my thumbs for symmetry. If you can say 99 for me.
99.
Perfect. And there was tympany noted, and I'm going to have you just breathe normally for me as I watch my thumbs expand with the chest to see if there is equal expansion on both sides. So if you can just take a nice deep breath for me. Perfect. So there was equal symmetrical expansion on both sides. And so next I'm going to move into percussion to examine any dullness or any areas where there's less noise or any dullness noted where there shouldn't be any dullness, and examine for the line of the diaphragm. So we're going to do this on the posterior as well as the anterior side. And then we're going to do this for 10 sides on the posterior and 6 sides on the anterior. There was some dullness noted along the diaphragm. And now the next part of the respiratory exam, I'm going to listen and auscultate the lungs for any adventitious sounds, any abnormal wheezing or sounds that could occur while we listen. So we're going to listen anteriorly as well as posteriorly, 10 spots on posterior and 6 sides on anterior. So I'm going to start on the posterior, okay? And if I can have you take a nice deep breath for me. And at this point, I would ask the patient if he feels any lightheadedness or dizziness. We could pause. Deep breath for me. Deep breath for me. Deep breath. One more. Good. And if I can just have you say 99. Right now, if you can say 99 for me.
99.
Good. One more time.
99.
Good. Okay. Now I'm just going to auscultate the anterior side of your chest, okay? Just deep breath for me. Deep breath. Okay. And one more. You can say 99 for me.
99.
Okay. 99.
99.
99.
99.
One more.
99.
Perfect. All right. So that concludes the respiratory exam. So if I can have you sit back on the bed there for me. So the next part of the exam, we're going to move into the abdominal or the gastrointestinal part of the exam. So I am going to have you lie down again for this part of the comprehensive exam. And for the exam purposes, this would not be done over clothing. The exam would be done under clothing, but for this purpose, it will be done over clothing, and we would have the patient up higher for optimal examination. So I'm just going to start by inspecting the abdomen first, and we would examine for any scarring, any redness, swelling, any abnormalities if the patient had any drains placed or any areas that would warrant a further assessment. And the next part, I would also examine for symmetry as well. And now I'm going to move into auscultation. And this part of the exam, I'm going to listen in all four quadrants for vowel sounds. I'm going to start with the right upper quadrant. Move into the right lower quadrant. And left lower quadrant. And left upper quadrant. Okay. And then the next part of the exam, after auscultation, I'm going to move into percussion, and I'm going to perform percussion in each of the four quadrants, and I'm going to perform it in a zigzag pattern for any dullness noted, which would be normal across the liver, or if there was any swelling of the spleen or an enlarged spleen. And there was dullness noted across the liver in the right upper quadrant. And then after the percussion portion of the exam, I would move into palpation. And for this part of the exam, I'm going to perform light palpation just to see if there's any tenderness or any pain anywhere. And then I would move into performing deep palpation. I'm just going to explain how I would perform deep palpation, especially for examining the liver, or if the spleen was enlarged, or if there were enlarged kidneys as well. So I'm just going to perform some light palpation and just let me know if there's any tenderness or any pain at any point. Okay. And then if I were to perform deep palpation, I would put my left hand over my right hand, and to examine the liver, I would be in the right upper quadrant, and I would be almost underneath the rib cage and would be deep underneath the rib cage. And then for the spleen, I would be into the left upper quadrant on the left side underneath the rib cage. And then in the renal arteries, I would be also up underneath the rib cage for the kidneys as well, if there was any, if the exam required that part of the examination. And then that concludes the gastrointestinal part of the exam, so you can sit up for me. And the next part of the exam is going to be the musculoskeletal system. So this is going to be much like the rest of the examination, where I'm going to start with your head and I'm going to move down to your toes. So the first part, I'm going to start by just inspecting the joints of the shoulders, the elbows, the wrists, the hands, the fingers, the hips, the knees, back, ankles, as well as the toes. And I'm going to start with the neck, so I'm just going to have you check the range of motion of your neck. So I'm going to have you turn from side to side for me, and then we're going to go front to back, and then we're just going to go around, and then around the other way. Perfect. And next I'm going to test the strength of the neck, and I'm going to start by just having you lean forward against my hand. Good. And then I'm going to have you lean back against my hand. And we're going to go to your left and then to my right. Perfect. And the next part of the exam is going to be the shoulders. So I'm going to have you bring your arms up to the sky and then back down to the side, to your side, and then to the back. And then out to the side. Perfect. And I'm just going to have you do a shoulder shrug against my hands. Perfect. Good strength in the shoulders. Next part of the exam is going to be the elbows. And so the elbows, I'm going to have you bring your arms up to your shoulders like this, and then out like this. And then I'm going to have you turn and put your palms to the ground. Perfect. And I'm just going to test your strength. So if you can put your hands up to your shoulder for me, thank you. And I'm going to have you push against me. And then I'm going to pull. Good. All right. And then next part of the exam, we're going to do the wrists. So I'm going to have you put your palms to the ground, and then bring them up to the sky, and then back down to the floor. And then I'm going to have you turn and do the same thing for me. And then just turn around like this, and around like that. Perfect. So now we're just going to test the strength of your wrist. So I'm going to have you put your hands like this, and then I'm going to have you grasp my hand for me. Okay? And then on the side. Good. Okay. Now you can let go. Good strength in the hand grip. And then I'm going to push against the hand. So if you can push against my hand, good. And on this side, good. And then hands to like this. And then I'm going to push your hand up. So resist me and resist me. Good. Okay. Next part of the exam, we're going to do your back. So in your spine. So if you can stand up for me, I'm going to have you bend at the hips. Okay, good. And then back, and then we're going to have you go side to side. Okay, and we would test for any pain or tenderness. I'm going to have you turn side to side, or if the patient wasn't able to turn from side to side due to low back pain or any other symptom that the patient was having. So I'm going to have you sit back down for me. And actually, I will actually have you stand again. I'm sorry. So now we're going to do your hips. So if I can just have you bring your left leg to the side, and then your right leg to the side, and then to the front and the back. And then front and back. Okay, perfect. And now I'll have you sit back down. And then the next part of the exam would be your knees. And normally we would have your legs dangling, but our couch is a little bit too low. So what I'm going to have you do is bring your knees, if you can extend your knees for me. So if you can extend, yep, and if you can, perfect. So that was the flexion and extension of the knee. And then what I'm going to have you do is just move against resistance for me. So if you can just, yep, push against my hand. And if you can push against my hand on this side, good. So now we're going to move into your feet or your ankles. And so if you can, so the feet would normally be dangling in this examination. What I'm going to have you do is plantar flex those or dorsiflex those feet for me, so up to the ceiling and then down to the floor. And curl those toes for me and bring those ankles in and then bring them out for me. Very good. And now I'm going to have you do is just push against my hand, bring those toes up to the sky. Perfect. Okay. So now the last part of the exam is the neurological exam. So there's a motor part as well as a sensory part, and then we'll test your mental status at the end. So we're almost done. Just bear with me, okay? So what I'm first going to have you do is I'm going to test your deep tendon reflexes, okay? So we're going to start by doing your triceps. We're going to do all of these bilaterally, and now we're going to do brachial. And we're going to do brachial. Okay. And we're going to do radial. And then we're going to move into patellar. Good. And down to your ankles. Perfect. Okay. And now the next part of the exam, what I'm going to have you do is I'm just going to test. So we already did the extraocular direction, so we don't have to do those again. We did those with the eye section of the exam. So what I'm going to have you do next is we're going to have you, excuse me, I lost my train of thought. So what we're going to have you do is squint your eyes for me, puff out those cheeks, and if you can smile for me, and frown, and clench those teeth. Perfect. And so everything on the face was symmetrical, which is what we look for. And the next part of the exam, I'm going to have you close your eyes, and we're going to move into the sensory part of the exam. So I just need you to tell me if this is sharp or dull.
Dull. Dull. Dull.
Okay.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Very good. Okay. And next what I'm going to have you do is if you can stand up for me, I'm going to have you walk heel to toe just across the room. Okay. And then if you can walk normally back. Good. And then if you can walk back to the other side of the room but on your tippy toes. And then walk back on your heels. Good. Okay. And now I'll have you take a seat. And then I'm going to have you bring your heel to your shin. Yep, so then your left heel to your right shin. Perfect. And now I'm going to have you bring your thumb to your fingers. Your rapid movement. Good. And now if you can bring your thumb to your nose. I'm sorry, your finger to your nose. Perfect. And then finger to nose on the other side. Good. Okay. So that's the motor section of the neurological exam. Now I'm going to move into the sensory part of the exam. So what I'm first going to have you do is take this piece of paper, and I'm going to have you just follow a series of directions, okay?
Okay.
So I'm going to have you take that, and I'm going to have you fold it in half for me. Fold it in half again, and then I'll have you put it on the floor. Good. And then if you can just tell me what time of day it is, where you are, and who you are.
Night, an apartment, and air.
And what are we doing right now? The situation. What's our background? What are we doing right now?
You're doing a physical kind of thing.
Yeah. Perfect. All right, so patient is alert and oriented, and times 3. And so the next part of the exam, I'm going to test your attention. So I'm going to have you count backwards from 100 by 5s.
100, 95, 90, 85, 80, 75, 70, 65, 60, 55, 50, 45, 40, 35, 30, 25, 20, 15, 10, 5, 0, negative 5.
Perfect. Thank you. Okay, and now what I'm going to have you do is We're gonna test your short-term, or actually, excuse me, your long-term memory. So if you can tell me what you did on your birthday last year.
Worked all day, went out to dinner.
Okay. And what did you have for dinner that night? Do you remember what you had for dinner that night?
Steak and mashed potatoes.
Sounds delicious. All right. So next part of the exam, we're going to move into your short-term memory. And if you can remember these 4 words for me: left, right, blue, purple. And if you can count backwards down to 0 from 20.
20, 19, 18, 17, 16, 15, 14, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
And what were the 4 words that, you told me at the
Left, right, blue, purple.
Okay, perfect. Alrighty. And so the next part, what I'm going to have you do is just close your eyes for me. If I can have your hand in my palm, I'm going to write something on your palm, and if you can tell me what that is.
A.
Perfect. Okay, and then still keep your eyes closed. I'm going to put an object in your hand, and if you can tell me what that object is.
Q-tip.
Yes, that is a Q-tip. Perfect. And then, so that is the sensory part of the exam. And actually there is one more part. So if you can close your eyes for me, I'm going to just grab your toe, and if you can tell me what direction we're moving in.
Up.
Yes. Okay, perfect. And now the last part of the exam, we're going to move into the psychological part of the exam. So I am just going to ask you, actually, no, I already did that. Okay. So I think that concludes the neurological part of the comprehensive assessment exam. Do you have any questions on anything or any concerns?
Oh, that's it.
All right, thank you so much for your time. I appreciate it.
Yeah, thank you.
All right, we're all done.